It's well known that some patients with diabetes and coronary disease do not experience classic angina and, of course, can have silent myocardial infarction. For me, patients with diabetes and coronary disease who do not experience angina are a particularly troublesome group because I don't know if they're in trouble with ischemia or not. Now in JACC, researchers help with this dilemma, answering the question of whether patients with diabetes and coronary disease with and without angina pectoris have different outcomes at 5 years. The analysis was done on more than 2,000 patients with type 2 diabetes and stable coronary disease who were enrolled in the Barre 2D trial. The researchers determined the occurrences of death and composite of death, MI, and stroke in a 5-year follow-up and compared patients with and without angina. Despite the fact that all of these patients had coronary disease, 1 out of 5 had no angina. Was there a difference in the two outcomes? The short answer is no, there was not. Death rates in these patients were around 12%, and cardiovascular composite rates were around 24%, but there was no difference in either outcome between these patients with and without angina. First of all, I'm impressed by the high rate of cardiovascular endpoints that these patients have at 5 years, almost 1 in 4. That seems like a lot. The authors point out that regardless of whether patients with type 2 diabetes have angina as a symptom of their coronary disease or not, they should be similarly managed in terms of risk stratification and preventive therapies. Second, and most importantly, prognosis in diabetics with stable coronary disease is driven by ischemia, not by the nature or magnitude of their angina. Don't let your patient with diabetes and known coronary disease lull you into a false sense of security just because they don't have chest pain. I'm Peter Block, and this is a CardioSource Heart Minute.